Healthcare in the United States is becoming increasingly unaffordable, with millions of Americans struggling to pay for even the most basic medical care. A new survey released Wednesday highlights a growing crisis. 11% of Americans reported being unable to afford medication or medical treatment in the past 3 months, the highest level recorded in the 4 years the survey has been conducted. Even more alarming, more than a third of those surveyed, an estimated 91 million adults, said that if they were to need medical care, they would not be able to pay for it. These figures reflect a healthcare system that is failing a large portion of the population, leaving millions to make impossible choices between their health and their financial survival. The survey, conducted by West Health and Gallup between mid-November and late December 2024, also reveals widening disparities. Low-income Americans, particularly Black and Hispanic individuals, are the hardest hit. A shocking 25% of households earning under $24,000 a year said they could not afford or access medical care in the past 3 months. This number reflects a stark reality. Those who need care the most are often the ones least able to afford it. Meanwhile, white and higher-income Americans reported little to no change in their ability to pay for care. The divide between economic classes continues to grow, ensuring that those with the least financial security are also the ones most at risk of suffering from untreated health conditions. Healthcare costs have continued to rise year after year, and the situation has been worsened by recent rollbacks in Medicaid coverage. Premiums are higher, out-of-pocket costs for doctor visits have increased, and many Americans are finding that their insurance plans no longer provide adequate coverage. The issue of underinsurance, where individuals technically have insurance but still face unaffordable medical bills, is becoming a widespread problem. Medical debt has already crippled millions of American families, and experts warn that the problem will only intensify if policymakers fail to act. Unlike skipping out on a luxury purchase, delaying or foregoing medical care has real and sometimes deadly consequences. The crisis is expected to worsen as lawmakers consider deep cuts to Medicaid and tax subsidies that make Obamacare plans more affordable. The Trump administration and Republican lawmakers have discussed rolling back billions of dollars in funding, a move that could result in millions of people losing their health coverage entirely. If these cuts are implemented, the United States will be heading back toward Pre-Affordable Care Act levels of uninsured individuals, reversing much of the progress made over the past 15 years. Many Americans who currently rely on government-assisted programs for medical care may soon find themselves with no affordable options at all. Health economist Sarah R. Collins describes the United States as not a country where health care is affordable, a sentiment that is increasingly echoed by those struggling to pay their medical bills. Despite the improvements brought by the Affordable Care Act, millions still face financial barriers to care. For many, insurance is no longer enough to keep them out of medical debt, as high deductibles and rising costs force them to delay or avoid necessary treatments. Tim Lash, president of the West Health Policy Center, warns that the financial burden on American families is already overwhelming and that cutting government assistance will only push more people into financial ruin. The future of healthcare in the United States looks bleak unless immediate action is taken. If nothing changes, more people will avoid seeking medical treatment until it is too late. Emergency rooms will become even more overburdened as they serve as the last resort for those who have no access to primary care. Preventable conditions will go untreated, and the number of deaths linked to lack of medical care will continue to rise. This crisis is not just an economic issue. It is a public health disaster that will have long-lasting consequences. The fact that one of the wealthiest nations in the world allows its citizens to suffer or die simply because they cannot afford medical treatment is a failure of leadership and policy. Unless lawmakers take meaningful steps to make health care more affordable and accessible, the situation will only deteriorate, leaving millions at risk.